Did you know that the majority of Latinas make up healthcare decisions for themselves and for their family? Hola, Poderistas. I'm Dr. Erica Montes, a board-certified obstetrician and gynecologist, and I'm here to talk to you about your health during Wellness Month. Let's get into a couple questions that are important to ask your OBGYN or your female healthcare provider. Number one, especially right now in this day and age, it's so important to find out your contraceptive options. There's a lot of new methods out there and there's a lot of misconceptions, so it's important to ask all your questions. The second thing would be to find out what would be a red flag around your period. And what I mean by that is talk to your doctor about your flow, your pain, symptoms you may have surrounding your period, and find out how you can be screened for certain female health conditions such as fibroids or endometriosis. Another question that's really important is, should I be screened for hereditary cancers based on my family history? I know sometimes it's difficult to find out or learn about our family history, but asking questions is definitely important. For example, Latinas do have a higher incidence of more advanced stages of breast cancer. So in order for us to decrease that risk, we need to be able to know if screening is important for us or not. And finally, one other question that's really important is, how can I improve my fertility, or how can I have a better pregnancy outcome? We know that women of color have a higher incidence of morbidity and mortality during pregnancy, especially in our country. And so in order to decrease those risks, it's important to have a plan. So the next topic I wanted to bring up is how to have a happy pelvis. It's very important to realize that some of the symptoms that your friends may say they feel as well, even though they could be common, that doesn't necessarily mean they're normal. And symptoms such as painful intercourse, urinary incontinence or leaking of urine, pelvic organ prolapse or a bulge that you may feel in the vagina, constipation, anything that relates to the muscles and the nerves of the pelvis, those can be signs that your pelvis is not very happy. It's important to know that there are specialists called pelvic floor physical therapists that are trained on these conditions, and it's very important to realize that you can ask your OBGYN or female healthcare provider how to find one of them. And finally, just a few other tips to have a happy pelvis. Please, please, please make sure you go for your pap smear screenings. Also important to be screened for sexually transmitted infections if you have any risks. And finally, if you're noticing any change, whether it be in your period or in your vaginal discharge, please be evaluated. And finally, I want to talk about bacterial vaginosis, or what we normally call it BV. And it is a vaginal condition where there is a problem with there not being enough good bacteria and an overgrowth of bad bacteria. Our vagina has hundreds of bacteria, and the most commonly known is called lactobacillus, and it actually protects us against BV. But when there is a disturbance in that bacteria, whether it be from multiple sex partners, an intrauterine device, douching, all that can cause that imbalance to lead to this bacteria called Gardnerella growing, and then we get the symptoms of BV. It is important to be evaluated because unfortunately there are some studies that show it can increase the risk of preterm labor if you're pregnant, and it has been associated with pelvic inflammatory disease, which can affect your future fertility. So if you have symptoms of BV, whitish discharge, sometimes yellowish, foul odor, anything like that, please go get checked so that way you can avoid complications in the future. So I want to thank everyone for listening to my health tips. You can find me at the.modern.mujer, which is a health blog where I talk about health, medicine, and empowerment. Hope you all have a great day.